Hi, I'm Dr. Tamra from Dynamics Physical Therapy, and I wanted to spend the time today to reshoot a fan favorite. It's a self-abdominal massage. I'm shooting this right before the holidays. Everyone's eating things that they don't normally eat. They're having a little bit more gas than they would normally have, maybe getting a little bit more constipated. So this is a great technique that we give patients here all the time for you to kind of rub and massage your stomach at home, which really helps with better bowel movements, to decrease constipation, and to help move gas through your system. So take a look. It's something that you can practice a couple times a day to help with your GI system during this hectic time, and I hope you enjoy it. So when we start with abdominal massage on ourselves, we just want to work on skin. So just roll your shirt up, and then ideally you'll use a little bit of lotion, but you can also just use your hands. And we're going to start in our lower stomach area, right underneath our belly button, and we're just going to kind of push back and forth. This is where our small intestines sit, and they sit right on top of our pelvis and can cause a lot of pressure, a lot of gas. So we're just going to wake those up, move them back and forth a little bit, and you might feel some gas moving when you do this. You shouldn't feel any sharp pain. So we're just kind of changing the pressure in our lower stomach right over our pelvis. And after you do that for a little bit, then we're going to start here in the bottom corner, and we're going to trace our colon. So we're going to come up towards our rib cage, and you can do some nice sweeping motions like this. And then once we get to our rib cage up here, we're going to turn like the colon does and go over to our other side of the rib cage. So we're going from our right rib cage to our left. And this is where you might feel some gas bubbles, you might hear some noises, which is a great sign that we're starting to move things in our GI system. A lot of times, especially in this upper right and left corner, gas gets trapped because it's a really tight turn to make. So we want to do those nice sweeping motions, and I'm feeling some really nice movement. And then when we get over here to our left side, we want to hook and come right down towards our belly button again. And this goes and traces our descending colon, which is then moving everything down towards our rectum. A lot of times when you do these sweeping motions, you might even feel some gas come out. Let it out. Gas isn't meant to stay in our bodies. And that's kind of the rhythm. So then we can go back to doing that nice lower abdominal massage, moving back and forth. And then starting in this bottom right corner, coming up towards our rib cage, and then over. And you might find some pockets that feel really tight and uncomfortable, and just take a little extra time and go over that. And then back to our left, we're going to sweep back down. I don't know if you heard that, but I just had some noises, which is great. So this is great if you're feeling some discomfort, especially after a lot of eating or after a lot of gassy foods, or if you're constipated. This is one of the best things you can do, especially at night before bed. Calms down your GI system, moves everything along, and can do so much to help with better bowel movements, less gas. One of our favorite things to give our patients for home. So that's how you perform self-abdominal massage.